Good morning, everyone. I've had the pleasure of meeting a few of you as we were walking around playing weed bingo. That was a lot of fun. I have not used a tincture before, but it has been recommended by several people, so I'm excited about adding that to my list of things. So maybe next time I'll help you win weed bingo and you can help me win weed bingo. I am here this morning to talk to you about the racialized history of marijuana policy and also its impact on health equity. And so the goal here really is to make sure that we're all aware of the story. And not just the big picture story of like, yes, there was this war on drugs, and that's kind of how we got here, but how exactly that was created, and how it integrates in with other risk factors that have happened in society. Because if we don't really understand the full context, it's hard for us to think about additional policies that we may need to pass moving forward, and ways that we need to think about operating. So, I'm sure many of you have heard about Reefer Madness, but that was sort of what was happening in the 30s and 40s. It was this idea that marijuana was the most dangerous drug possible, but a lot of it had to do with the racialized way in which it was framed. And so Harry Anslinger was the very first commissioner of the Federal Bureau of Narcotics, which later became the DEA. And what he is quoted as saying several things, but you'll notice a commonality that they have. And one of his most famous quotes is, there are 100,000 total marijuana smokers in the US, and most are Negroes, Hispanics, Filipinos, and entertainers. Their satanic music, jazz and swing, result from marijuana usage. This marijuana causes white women to seek sexual relations with Negroes, entertainers, and others. It's ridiculous, right? But this is the thinking that undergirds everything that's happening, and it was undermining some of the other processes in place that were telling a different story about marijuana. He's also quoted as saying, Reefer makes darkies think they're as good as white men. So a lot of this was built into the pathology of understanding race in the US. And so it's very easy to demonize something once you associate it with people who are already castigated. So if we think about the timeline here, I think it's important for us to sort of walk through and understand what was happening. So 1930 is when the Federal Bureau of Narcotics is created. As I mentioned, that's the precursor to the DEA. And Harry Anslinger ends up being, he's there basically from 1930 through the 40s and the 50s through 1960. And so once you see that, you sort of recognize what his tenure encompassed. In 1944, 14 years after the Federal Bureau of Narcotics was created, the New York Academy of Medicine came out with a report. And they concluded that marijuana use did not cause violent behavior, provoke insanity, lead to addiction, or promote opiate use. And this was categorically dismissed by Anslinger. He didn't want to hear it. The science was there, and much like the conversations we now have about climate change and other things, the person who was in charge of the Bureau completely dismissed it because it did not fit his narrative. And then during his time, he went on to help pass the Boggs Act, which made mandatory sentences for marijuana possession between 2 and 10 years. And what impact that had, as we often know, is that when that happened at the federal level, many of the states then started passing what were called Little Boggs Acts. And these happened for about a 10-year period between 1952 and 62, where people were passing these other state laws. So on top of what the federal conviction would be, you'd also have a state conviction for the same charge. But then the Daniel Act came along 4 years after the Boggs Act that increased the Boggs Act penalties 8 times. So instead of having 2 to 10 years, you multiply that by 8. So all of this is happening under Anslinger's leadership, which again spans 30 years. So then we get to 1970, and that's when the Controlled Substances Act is passed. And shortly thereafter, Nixon declares the war on drugs and declares that marijuana, along with several other drugs, are public enemy number 1. That talking point is really important because it has implications for how then we create programs and we govern and create policy for years to come. Following that, in 1972, the Shafer Commission report advocated for decriminalizing marijuana for personal use. And once again, leadership flatly rejected that. Nixon said, no way. I just spent a lot of money on the logo for the war on drugs. We're not backing out now, that's my baby, right? And it's all layered on top of what's already happening in the country. The DEA then, 5 years later, acknowledged that decriminalization was worth considering during the Carter administration. But Carter was not reelected, and so come 1981, the DEA now is saying marijuana is the most urgent drug problem facing the United States in the Reagan administration. And so following that, during Reagan's tenure, we have the Comprehensive Crime Control Act, the Anti-Drug Abuse Act, and the Anti-Drug Abuse Amendment Act, all of which basically raised the federal penalties for marijuana possession, cultivation, and trafficking. And the sentences were determined by the amounts that you possessed. So the more you had, the longer you were sentenced. And so this is the impact, this is the story that we have to tell about what policies were in place and what they were founded on. So what was the impact? Well, the impact was community trauma. We often talk about individual trauma, and I'm sure some of you in the room have heard about something called adverse childhood experiences. Well, one of the adverse childhood experiences in that initial study was having a parent or other relative in your household who was incarcerated, not being able to meet your basic needs. And so all of that was happening to children of parents who were convicted under these drug laws. And felony convictions were particularly harmful to families because they challenged your immigration status, your child custody, your employment, your housing, your ability to access social services. And one of the things that we know beyond a shadow of a doubt is that because of where this started, and because of the narrative that was shared around this, the criminalization also was largely concentrated in Black and Latino communities. And the data are very clear that the difference in arrests and convictions is entirely attributable to racial bias in law enforcement, and not differences in patterns of use. Entirely, not partly, not somewhat, not maybe a little bit, not on Tuesdays and Thursdays, entirely attributable to racial bias in law enforcement. The other thing we have to recognize is that 90% of those arrests and convictions were for simple possession. The vast majority. But we have to understand this also in a context of what else was happening. Because the war on drugs wasn't the only thing that was happening during this time since the DEA was established. We also had other institutional practices that it was layered on top of, one of which is redlining. And for those of you not intimately familiar with redlining, it was the official practice from 1934, 4 years after the DEA was formed, until 1968, only a few years after Anslinger was no longer over the DEA. And it was essentially where they gave grades to neighborhoods. A was the best, B was still desirable, C was definitely declining, and D was hazardous. And that was done based on who lived in those communities. So A communities were entirely white. They were more affluent. B communities had people who were previously not considered white, but over time as whiteness shifted in definition became white, Catholic, Irish, Italians. Then we had C communities, which meant that you now had people who were not white living, by any definition, living in them. So that included Latinos, that included Asian and Pacific Islanders, that may have even included a Black family. But once you got more than one, you were a D community. And those were hazardous, and that was where we weren't going to back mortgages, we weren't going to heavily invest. And I'm not one of those people who likes to argue with people about things that are very clear. So what I will say to you is, go to the FHA and read their definitions, because much like the Articles of Cessation, Jefferson Davis was very clear about why they left the Union. It's not up for debate, and neither is what the Federal Housing Authority was trying to do. It's very clear who was considered to be part of an A community and who was considered to be part of a D community. So when we think about this timeline, going back to it, redlining was happening during a big chunk of it. And so as these Boggs Acts and Little Boggs Acts and Daniel Act were being passed, where do you think the enforcement was going to be able to look for and arrest people? Because Anslinger already had an idea of what marijuana was, who was using it, and why it was dangerous. And so the enforcement was laid right on top of that. So when we think about the legacy of redlining, which this year has been 50 years since the practice officially ended, well, 2/3 of the D areas are still inhabited in 2018 by mostly Black and Latinos. And 91% of the A areas remain middle to upper income today, and 85% are still majority white. Why is that? Well, I don't know about you all, but nobody came along and offered my family a house in the APE community after we did away with this practice. We just stopped officially doing it. And I say officially because for those of you who were closer to the Sacramento area, you know that Davis right now is in a big battle with one of their developments because it says we have preferential treatment for people who live here. And the people who live in Davis and not the broader area are more likely to have been white. Because again, of redlining. And preference is still legal. So they can't legally keep people out anymore, but they still can write preferences into new developments. And I say that very seriously because I had a colleague, after I started talking about redlining and gave a presentation like this, who came and brought the deed to her house to me. And the deed said she lives in Davis, she's in her 50s. Her parents bought the house during redlining. She now owns it, her parents have passed away. And she has some daughters that she's likely going to pass the house down to. And on the deed to the house that she brought into me, it says, this house cannot be sold to Mexicans. Now, obviously, it's not enforceable in 2018, but it was enforceable when her parents bought that house for $22,000. If you know anything about Davis, you know that house is not worth $22,000 now. And for at least 2 generations, there are people who have not paid anything but taxes on that house. Institutional racism meets generational wealth. Meets drug policies. And so we still see differences in these communities in terms of home ownership rates, in terms of home values, in terms of credit scores, and in terms of overall health and life expectancy. Because again, this has more than just an impact on whether or not you were arrested or convicted, it changes the entire dynamic of a community. That's what we talk about when we talk about public health. It's the idea that it's not just about what happens in a physician's office, but it's about where you live and what your community looks like. So what does health equity look like? Well, I'm sure some of you have seen these images before. You know, equality is giving everybody the same thing and hoping for the best. But if we know that everybody attending a baseball game isn't the same height, then giving everybody the same thing isn't going to end up with everybody being able to see the game. Because the littlest kid got a box and still can't see. And the adult already can see over the fence. So we gave them a box, they just have a better view now. And so we talk about equity being, well, let's figure out who needs what and give accordingly. And that certainly is a great framework for what we're trying to do. But the goal here of health equity is actually liberation. And so the question we should all be asking ourselves is, how do we tear down the damn fence? Instead of stacking boxes, let's talk about tearing down the fence. And that involves institutions. We can't just stack boxes because we're not going to get anywhere. Boxes are temporary. Tearing down the fence means that everybody is able to access from where they are. And so we really need to begin to shift our thinking to tearing down the fence. So when we think about what are health inequities, we're talking about systematic and unjust differences in health and wellness. Okay, these are not natural. This is not supposed to happen. This is created. It is a social phenomenon based on how we structure our society, often related to who we allocated resources and who we did not. And so it is our responsibility, especially those of us in public health, to remediate these inequities. And so when we think about health equity and marijuana policies, the first thing we have to think about is what we talk about as community trauma, which can cause toxic stress. And so that's the trauma associated with criminalization and the community damage that came from that. We can't ignore that because that's part of the equation in terms of being able to right wrongs and being able to tear down the fence. The second is the environment. And this is where we have to really think about advocating for policy strategies that protect communities. And what do I mean by protect? Well, what I mean by that is that We often have focused on decriminalization, and that is absolutely a fence-destroying strategy, and it's good for us to do that. But the flip side of decriminalization is often legalization and commercialization. And once we commercialize things, we used to have big cotton, and we fought an entire war between each other over big cotton. That's really what the Civil War was about. It was about the ability to have free labor to pick cotton. Then we had big tobacco. And we spent years fighting big tobacco and trying to make sure that we could protect the community's health. Because there was a time when all of you who came from Southern California would have gotten on a plane today that had a smoking and non-smoking section. And you want to tell me how that works when you're on a plane and I can smell the person's breath 3 miles away. We can figure that out another time. But we used to have that, right? And because we were fighting a huge industry, how do we think about some of the vulnerable populations like youth, people with mental illness, pregnant women? And so we need to start to think about what are some of those strategies that we put in place to make sure that our legalization doesn't come with harmful consequences to people who are already vulnerable because of our institutional policies. That is an important consideration, and we're not doing good health equity if we don't consider that at the same time. And then, of course, the injustice, and really remedying injustice. And so that's where we talk about reversing some of the historical policies that have harmed communities. So Prop 64 was certainly one. And certainly the expungements bill, which was just signed, is another one. But we need to also think about reparations. What do we do with the tax money that's coming in? We need to think about equity programs. How do we ensure that people who have been harmed by the war on drugs have an equal opportunity to be able to come in and participate in the businesses that are now being created? And then how do we also focus on predatory policing? Because all of those marijuana possession charges were because of predatory policing. And the police got a pretty significant chunk of money from the marijuana tax revenue, and we need to think about what's going to come next there. And I'll talk about that really quickly in a moment. So I say this a lot of places, that hope is not a strategy. It's a helpful thing to have. It's good for all of us to wake up in the morning hopeful, but hopefulness is not a strategy. And so we started to tear down the fence when we started thinking about some of the discriminatory practices that were associated with the drug war, and generally with some of that crime bill that we passed in the mid-90s when everybody thought it was a good idea. And so Prop 47 and Prop 64 are doing a good job. They're the first steps in that. But we have to continue to focus on systems, because neither of those policies is perfect. And they're also not really focused on restoration of historical wrongs. We think about the entire pool of money that's coming in for Prop 64, only $50 million is going to be dedicated to the community grants program. And that's woefully inadequate. Culture change is going to take courage. It's going to be costly and uncomfortable, and that's where we need to be. So when we think about the funding, the starred areas are those ones where there are some equity principles that have been built in. The community grants program, which I know we're going to talk about in much more detail later. The youth fund, which is going to the Department of Healthcare Services. And then thinking about the environmental protections. Because we could have a whole other conversation about environmental racism in the US and layer the exact same maps on top of the redlining maps and the war on drugs maps and so many other things that we don't have time to get into today. But the place that I want us to make sure that we focus on is the fact that law enforcement is getting 20% of that remaining pot, in addition to $3 million going to highway patrol. And I have the unfortunate distinction of sitting on the Sacramento Sheriff's Community Outreach Advisory Board. And for those of you in Sacramento know, it's a fool. And I am the only person of color on the committee. I am the only person under 65, and I'm probably the only person who didn't vote for him. And when we have these conversations, and I push back at him, he says that, you know, when you get a DUI, you get 2 charges, and it's for alcohol. One is for driving while impaired, and the other one is having a blood alcohol content over 0.08. You know, we don't have a scientific standard for intoxication when it comes to marijuana consumption. And there's a lot of data showing that, you know, measuring THC is really prejudicial because some people will have high THC and no impairment, and some people have low THC concentrations and a great amount of impairment. So they currently have no scientific standard. And so when they're pulling people over and saying, well, we assume all they now can charge you with is the DUI portion, the driving while impaired. But there's no scientific standard for you to be able to come back with a defense and say, I wasn't impaired. And so now it's your word against the officer's word. And who are we pulling over for these charges? If we think the patterns of criminalization have changed, they have not. And so we really need to think about what we're doing with these funds and how this is going to impact equity moving forward. Because we're still in a place where we need to fight. We haven't completely destroyed the fence. We've only destroyed part of it. And so we need to keep chipping away at it until everybody is able to see the baseball game. And so that's the place that I'm encouraging us to be today. Those are the things that I want us to think about because we have a lot more work to do. So I want to thank you for this time. And if I have a moment or two, if anybody has any questions, if not, I'm here all day. I have business cards. You don't have to take pictures. If you want a card, I'll give you one. And I will also share the presentation with you for those of you taking pictures. I'm happy to do that as well, and we can talk further. But thank you for your time.